These are news bulletin for tonight. The 2017 to 2018 budget was presented by the acting Premier during the Assembly meeting yesterday. Health Department confirms that there are no new cases of dengue fever on the island. Niue Health Department educates to village reps about prevention of non-communicable diseases. Yesterday, the appropriation bill was presented by the acting Premier, Honourable Billy Talangi, on behalf of the Minister of Finance, Sir Toke Talangi, who is currently overseas. Niue has come a long way over the past 2 years. The path it's taking is one that it's leading to be a prosperous, populous and a strong in all facets. The impact of changes that have been made with the transformation will take time. Like any business, we don't expect to always make a profit in the first year, but it will happen. The recurrent budget is used to help support government ministries and departments. In essence, it pays staff, pensioners, general maintenance and the purchase of office supplies and fuel. Government will focus on creating consistent revenues of initially $5 to $10 million annually to help pay our way, ensuring all government trading operations are managed commercially and not be dependent on government subsidies. Niue government will assist and create new businesses using the natural assets Niue have, as well as protecting its sovereign assets, maximizing any returns from them. Government will also continue to provide support to communities. They are important to the country as a whole, offering spiritual and cohesiveness to the people. The first and second reading of the budget was passed by the members of government yesterday. The budget will be handed over to the Public Accounts Committee and will be presented in a month's time to the members. Niue Hospital confirms that there are no new cases of dengue fever on the island. The last case was recorded on the 8th of June and the patient has been in isolation for the past 14 days.
And we are hoping that by this weekend we will not have another confirmed case of dengue fever on the island, so that we are able to lift the dengue alert period that has been imposed on the island for the past month and a half since the first cases were confirmed. We have already had consultation within the department and our Director General for the Ministry of Social Services, and we have already discussed the possibility of the department changing the insecticides that we're using right now for the mosquito spraying program. So that is to ensure that the insecticides that have been used for the past 2 years, we don't develop insecticide resistance, and that is, if we continue to use the insecticide, they won't be able to help with killing the mosquitoes. So we have already decided that we will change the insecticides to the next two on top of the scale. So we're also looking at reviewing the response plan that we had, to make sure that next time when there is an outbreak, we'd be able to take actions immediately. And then we also like to encourage active participation from the communities to make sure that we don't have any further cases.
The Health Department continues to encourage the public to use mosquito coils, repellent, and to also clear mosquito breeding places. The Health Department have been educating a number of village health representatives for the past 2.5 days about healthy living. During a non-communicable disease survey that was carried out a few years ago, it had showed result that diabetes, high blood pressure, smoking and alcohol were the most concerning issues on Niue.
Risk factors: diet, physical activity, tobacco smoking and alcohol use. So those are the key risk factors that we talked with the participants here. So it's really providing them with the information, so that when they go out to the community, they have an idea of the right information to share with the people. And some of the skills that we worked on was around motivational interviewing, which is one of the communication tool really, because our main focus is to motivate people to change their behavior.
The main focus of the training is to educate village reps on healthy living and healthy eating, as well as the importance of physical activity, so that the village health workers are able to monitor people's health, especially the elderly people and children.
The Department of Health have been working over the years to raise the awareness about NCDs in our communities. People are still not improving. The health status of our people are still not improving. So hence the workshop. So hopefully when we do another survey in the next few years, there we will see some difference.
The World Health Organization will also be conducting a health workshop next month as a part of the health's ongoing project with the village representatives. That concludes our coverage for our news bulletin for tonight.